Hey guys, Dr. Ford. So it's been another week, another challenging week, and we've seen cases go up once again to over 800,000, and we've seen the number of deaths unfortunately increase to over 45,000 since the last time we spoke. But look, there is some hope on the horizon because remember last week I said we were starting to see some flattening of the curve. We talked about kind of what that means, the number of new cases every day starting to decrease, and we're continuing to see that trend. There are some exceptions day to day, but overall, we are continuing to see a flattening of the curve. So, for everyone out there that is participating in this by social distancing and hand washing and spreading the good word, informing people, and helping to educate your neighbors, friends, and family, congratulations and thank you for your contribution. It's noticed and it's working. So I wanted to touch on a couple of topics instead of sticking to statistics this week. Number one, I want to talk a little bit about mental health. We spoke about it in a previous talk, but I just want to reiterate. Look, this has been a very challenging time for a lot of us, especially those with underlying mental health conditions. So if you are one of those people, um, do the best you can to indulge yourself. Go for a walk when you need to. Take the time and the headspace when you need to. And don't be afraid to reach out to friends, family members, or maybe even a stranger or a neighbor if you're just feeling like you're losing control and you can't stand it anymore. Also, I have no affiliation with this site. Maybe it would be nice to, but I don't. But there's a website that several of my patients have visited called Talkspace that they actually receive therapy there from licensed therapists, and the feedback I've gotten has been really good. So maybe check that out, Talkspace. And there's one for meditation that's actually also, I haven't tried myself. I've researched it. It seems to be very helpful, and I've heard really good feedback from it called Headspace. And that's for meditation and mindfulness. Two very important, valuable tools when we're talking about mental health and the challenges that individuals who have underlying mental health are facing in this lockdown. Now, if you are not somebody with mental health or feeling especially challenged during this time, you probably know someone who is or who might be. Please reach out to them. Just give them a hello. You don't have to dive into their business or anything, but just touch base. Let them know you care. Let them know you're thinking about them. Trust me, it can make a world of difference. So that's what I wanted to say about mental health. So two important topics, right? Because hopefully, and it seems like we're getting closer to kind of a gradual opening of our economy and easing some of these restrictions, but we have to do it safely first. So how do we do that? First, look, the mask issue. Do you need to wear a mask? In a lot of places, it's mandated in public. And the why behind that is not to protect you necessarily, and we've said this before, it's to protect those around you. Because remember, this infection can be totally asymptomatic or pre-symptomatic, which means there's a window of a few days before you feel any symptoms where you can still be infectious and spread the infection. So wearing a mask prevents you or significantly decreases the chance of you spreading this virus just by breathing, talking, coughing, etc. So we're protecting the more vulnerable people in our society, in our community, and we're also stamping out the spread by wearing a mask. So that's why we should be wearing masks, guys, and the science is there. I understand, again, when we watch the news and there's politics and stuff behind some of these recommendations, but for now, let's follow the science and the medical recommendations as long as they're not doing harm to us. So those are masks. Number two, a very important topic we need to discuss is testing, right? So we've had a lot of people come and do antibody testing with us, which is awesome. But I'm more excited about the fact that antibody testing is becoming more and more available. At least in Los Angeles, I know the mayor's doing a great job at getting some of the public testing sites available for people to undergo testing and antibody testing. So what is antibody testing? Well, let's take a big step back. So our immune system is this complex machine, right? So let's think about our immune system like we think about maybe the military or a police force because they're fighting for us on the inside, keeping us alive, keeping us healthy. So some of the first players on the scene that will encounter an invader, like a virus or a bacteria, and in this case, COVID-19, um, are these immune cells called neutrophils and macrophages. And they're always cruising around scanning for any kind of invader or parts of an invader, and they gobble them up. And then they present these pieces that they gobble up to our immune centers, our lymph nodes, different areas in our body. You've all felt a sore lymph node before, those bumps maybe in your neck or your arm, and it's when you get an infection, right? So the macrophages, neutrophils, they gobble up these pieces of the virus, they present them to B cells and T cells, but we'll keep it simple. And these B cells are plasma cells, and they are the ones that make our antibodies. And antibodies, think of antibodies like weapons that our immune system can use. And so they produce these antibodies. The first antibodies they produce appear within about 3 days of you getting symptoms or of you getting the infection, and they're called IgM, M as in Mary. These antibodies are somewhat specific to the bug that's invading. Again, in this case, we're talking about COVID-19 antibodies, but we also have antibodies to, the flu if we're exposed, or, other viruses if we're exposed. When you get a vaccine, right, to smallpox, or, when the polio vaccine, those are meant to trigger a B cell response to make antibodies to prevent us from getting this infection again. And we're going to touch on that. So in this case, we're talking about COVID-19. You're exposed. The first antibodies we can test for on the scene are IgM. And after about 7 to 10 days, that IgM response starts to go down. And we start to see an increase in the other type of antibody that's more specific, called IgG. IgG antibodies stick around much longer than IgM in most cases. And they are the antibodies that can, in some cases, convey long-term immunity, meaning if you're exposed to a virus or a bacteria or a bug again, and you have a good stock of IgG antibodies, you are virtually immune, meaning you won't experience any symptoms, and if you do, they'll be very mild symptoms, but your immune system can quickly overwhelm the invader with this existing stock of IgG antibodies. Now, this is very important, and I want to be very clear here. Look, that is the natural, usual course, meaning that is what we've seen in the past. But we've also seen instances of immunity not lasting very long. And you get a short window, 30 to 90 days of immunity in some cases, like with the flu virus, and then it kind of fades away. What we're seeing with COVID-19 so far has been mixed, right? Some people are having relatively long-term so far. It's a new infection. So people that have IgG antibodies, remember that's the long-term antibody, sticking around for 60 days or more, right? However, we are seeing plenty of cases where they have the IgG, the long-term immunity antibody, when we first test them, and then when we retest them, it's fading away to levels that are so low, it doesn't count as a positive test, or it's so low that it's not even registered as a trace finding, is what we call it. So why is this important? Because we need to continue to do more research to figure out the best way to combat this virus. And if we're going to come up with an effective vaccine, that vaccine better darn well trigger our IgG response to last longer than 20, 30 days. That stuff is in the works. Don't panic. Don't think we're never going to get rid of this thing. No, the science community is hard at work trying to answer these questions. And what's going to be very important here is coming up with a treatment where we can amplify antibodies, right? So convalescent serum you've heard of. We're taking the serum from people who are infected, who have cleared it, and they have antibodies, and then we can give those antibodies to someone who's sick or infected with the COVID-19 infection. Those studies are undergoing, and I'm happy to say we are going to be participating in that study. So more news to come on that. But this is really the solution for us to be able to kind of open things back up and get back out on a mass level. We need to come up with some treatments. And right now, the convalescent serum, where we can take antibodies existing in someone who's cleared the infection, give them to someone who's sick, is one of our best chances at getting the upper hand on this virus. And in the meantime, in the background, yes, vaccine trials are undergoing, so don't fret. We will continue to work on this until we beat it, because that's who we are. In the meantime, love to hear from you guys, like I always say. Please feel free to reach out with questions, comments, any clarifications on this testing stuff. I know it can be kind of confusing, but most of all, look, if anybody tells you you have antibodies, so you're immune now, you can go out, you don't have to wear a mask. And look, people have been told this, patients have come to me and said, we tested with facility X, I won't say their name, and they told me I have IgG antibodies, so I don't have to wear a mask and I'm good, congratulations. Look, that's not true. We don't know that yet. Please continue to practice all the social distancing recommendations, the hand washing, the mask wearing in public. God forbid you get infected and you think you're immune, or you infect somebody else when you think you're immune. So let's continue to work together on this, guys. And I look forward to speaking to you next week. Until then, be well.